Hello everyone and welcome to my channel. My name is Jasmina. I'll give you a bit of a background story about myself. So I'm currently in my 4th year studying my bachelor's degree in dermal science. Now I have created this page to educate the wider community on lymphedema. Now this topic is something I am highly interested in. I've loved lymphedema from the moment I learnt about it at uni. And I really hope to further provide more information about lymphedema to everyone. So this is why I've created this video, and there'll be more videos following this one. So please like my videos and subscribe to my channel so you can see what videos I'll be posting next time. And also please use the comment section down below to comment any questions you might have about lymphedema or anything regarding lymphedema. So firstly, what is lymphedema? So it actually is a chronic and progressive condition, and it is identified by the accumulation of protein-rich fluid within our body. Now, when we do have this fluid within our body, a lot of the time the lymphatic system cannot effectively circulate this fluid around the body. And that's when we see the swelling of limbs, we see localized pain, we see atrophic skin changes and progressive infections. So in the early stages of lymphedema, we see physical symptoms and features of pain, pitting edema, discomfort, we see heaviness of the affected limb. So if no treatment actually gets carried out, especially earlier on, this condition can progress significantly to thickening of the skin and irreversible non-pitting edema. So edema is a real swelling of the limb that we see very, very commonly in lymphedema. So those affected experience a higher rate of developing chronic skin disorders, and these skin disorders include cellulitis, ulcerations, and impetigo. So I'm going to talk more about the etiology of lymphedema, and it can be classified in 2 groups, either primary or secondary. So firstly, I'll be looking into primary lymphedema. Now this mainly occurs due to an absence of the lymphatic system or an abnormal growth in the lymph nodes. So it is a rare form of lymphedema and it is inherited. So starting symptoms are usually seen at birth or can be seen later on in life as well. So as seen in these images here, we can see in that first picture, we see a 1-year-old female with lower leg swelling. Then we have our second patient there, that's a 6-year-old, and with some swelling of the limbs too. Then we have a 15-year-old, and then our last photo there is a 48-year-old. Now all of these patients all have signs of primary lymphedema, and we can just see how even in infancy the swelling of that limb there. So now let's move on to secondary lymphedema. So this occurs due to an acquired impairment in the lymphatic system. So the common causes that trigger this are actually chronic infection, trauma, and cancer, and also injuries as well. Actually, breast cancer patients are seen to be the most common cancer associated with secondary lymphedema, and this is mainly due to the treatment that the patients undergo during breast cancer. So another common cause associated with lymphedema is actually being overweight or obese. Now, mainly focusing on our BMI, so our body mass index, and this gets measured mainly by a healthcare professional, and by the increases in body weight it actually increases our chances of developing lymphedema. So it's really, really important that if you have any concerns about your BMI, so your body mass index, that you do see a doctor immediately, just to reduce your risk or to identify your risk of developing lymphedema earlier on. So now we're going to look at some staging. So staging has been put into place because lymphedema is a chronic condition. So this means that it does not improve over time, rather it slowly worsens. So it's been set out in 4 stages. So we can see here we have lymphedema stages 1 to 4 on the arms. We can see stage 1. This indicates a pretty normal extremity clinically, but there is abnormal lymph transfer. Stage 2, we can see a bit more of that oedema, so that's swelling in the arm. Now this can be improved with elevation. So if the limb affected is placed on a pillow or a little stool, just to elevate that limb. So stage 3 actually represents as pitting oedema, and it actually does not resolve with elevation. So then we have our stage 4. Now stage 4 is seen to show more large deformed limbs, and then we do see it's more of a thickening of the skin, and warts can actually start to form on the skin too. So we can see with this patient here, they do not have warts visibly that we can see, just mainly that deformed large limb. Now I'm just going to move on to what it may look like in the legs. So we can see here stage 1, we can see some mild oedema, so mild swelling in the affected limb. Stage 2, we can see more of that swelling, especially around the ankles there. You can see a major difference. Then we have our stage 3, which is that very, very swollen look. That's quite visible just looking at it quickly. Then we can see our stage 4. So we can see that very deformed large limb, and it has a significant difference to the other limb that's not affected. So there's also some testing that can be put into place to identify either lymphedema or pitting oedema. So again, oedema is that swelling that is visible. So here, this is called the pitting oedema test. So this can be done from home. So what you do is you use your thumb and you push down onto the dorsum of the hand or foot that's affected for about 20 seconds. And if the imprint of your thumb, the tip, as seen in the picture here, if it's seen to not bounce back up after 30 seconds, there is a high chance of pitting oedema. So we can see that skin is still quite indented in, and if that doesn't bounce back up within 30 seconds, that is a very high chance of there being pitting oedema. I just want to quickly note that it's very important that if you do think you have pitting oedema, please see your doctor immediately. This is an at-home test, but it does not diagnose your condition. So another test that can be performed is called the stemmer sign or the stemmer test, and this is performed by your doctor. So as seen in the image here, if the skin cannot be pinched in the dorsum of the hand or the foot affected, this actually indicates a positive stemmer sign, meaning it is highly likely that the patient actually does have lymphedema. So we can see here in the image that the affected limb, you can't really pinch that skin. It's quite firm. So we can see that there is lymphedema of that limb. And that can be only performed by your doctor. So thank you all so much for watching. I will add in all my references down below in the description box on where I've got all my information from. Please leave any questions you might have in the comments section. Also subscribe to my channel so you can view my next video, and then I'll be talking more about lymphedema, ways you can manage it, treatment of lymphedema. And if you have, again, any questions, please let me know. Any suggestions, also let me know in the comment section down below. Thank you.